Hi everyone, Dr. 𝗪𝗪𝗂𝘂 with 𝗂𝘀𝘂𝘂𝗹 Chiropractic and Wellness. And today we're going to talk about something that affects almost as many people as low back pain, and that's neck pain. Now I personally have dealt with neck pain in my past through a wrestling injury, and so I know how debilitating it can be. When the thing that is holding your head up is the thing feeling pain, you don't want to be upright very often. And now it's so common in our society today because of our day-to-day habits. We have phones and tablets, and we have computers that we're at for most of our day. Then we sit to drive, sit to eat, sit to watch TV. And when we have a 10 to 12 pound bowling ball on top of a broomstick, which is kind of about the size of your spine, it can be a little bit hard for the neck muscles to do that all day long. And so then we end up having pain throughout the day, or it gets worse throughout the day. Now, if it's when you fell off a ladder, you experience neck pain, or you fell down a flight of stairs, or you were in a car accident, well, that's acute pain. And that can be something that is dealt with fairly easily and right away. When it's chronic neck pain due to a muscular imbalance with the muscles in the back of the neck compared to the front of the neck, and muscles in the chest area and in between the shoulder blades, when they are out of balance, they throw our body off. And so what can happen is we have poor posture from fatigue, we don't have the proper muscle balance, or also the head then comes forward, and now I have the bowling ball on a broomstick hanging over a cliff, and we start having tension headaches and neck pain through that too. And when we deal with neck pain, it's always a great idea to have a thorough examination and making sure that you're going through the proper neurological, muscular, chiropractic, and orthopedic tests to decide whether or not the problem is coming from the bony structure, whether it's coming from the joint itself, the muscular structure, or a combination of all of them. And so when we do these examinations with patients, we want to make sure that we're hitting all the points and getting to the root of the cause of your neck pain. Now, while that examination is so important is because neck pain can come from many different sources. You can have, again, like I said, an old injury like I did myself, and the altered biomechanics, or your change in motion due to your pain, if not dealt with, can lead to more degeneration, arthritis in your neck, and arthritis can be another one of those things that causes pain in your neck. You can have a ruptured disc, so if you're having symptoms of numbness and tingling down into your hands, or into your fingertips, or into the shoulder or arm, that can be a sign that it's coming from your neck. So with a structure that has so many blood vessels and nerves and muscles and bones all in one area, also your brain stem, which comes down out of your brain and goes all the way down to the second cervical vertebra, is housed within the neck as well. So your body and brain want to protect that area as much as possible. And so there is a need for pain if we are putting the neck, the brain, and the spinal cord in situations to where it thinks it needs to protect it. Well, we will have pain until we change how we are using that structure, how we are moving that structure. And that's where our rehabilitation and our care really comes into play. So getting a proper diagnosis for neck pain is crucial because it can also be tied to other problems in your body with your internal organs, such as problems with your kidneys, your pancreas, your liver, your heart. They can all refer pain into your neck. And that's why you want to get on top of it as quickly as possible. Also, with just plain neck pain too, if it's been going on for a long period of time, or it consistently shows up 3 times a year, that can mean that you have a more serious underlying cause. And just like anything else, like a leaky roof, the longer you let it go, the worse it gets. So we always suggest if you're having any type of neck pain, and it is sticking around, or it's harder for you to deal with on your own, that you make sure you come in, you get evaluated, and at least that way we know what is the cause of your problem, and then what the path might be to take care of it. I'm Dr. 𝗪𝗪𝗂𝘂𝘂 with 𝗂𝘀 Chiropractic and Wellness, and we'll see you on the next video.